In this video, we'll be reviewing Parkinson's disease by critically thinking through 5 Parkinson's questions. I will read the question, and then I'll pause to give you a chance to think of your own answer. Then I will read the options. Afterwards, there will be a quick discussion of why the answer is correct. This is just a surface review of Parkinson's. If you need more details, you can find that in your nursing resources under neurological, neurodegenerative, and/or mobility disorders. The question will also contain information on the medication levodopa. Let's get started. Question number 1. The nurse is caring for a client with Parkinson's disease. The patient is learning about the disease. Which statements about Parkinson's made by the patient are correct? Select all that apply. Is it number 1, Parkinson's is a disease involving the decrease in dopamine? Is it number 2, Parkinson's is a disease involving the increase in dopamine? Number 3, Parkinson's disease is curable? Or number 4, if I continue to stay active, I can have a better quality of life? In doing select all questions, we advise that you use the true-false method. Number 1 is true, number 2 is false, number 3 is false, and number 4 is true. The answers are 1 and 4. And the thought should have been that Parkinson's disease is neurodegenerative loss of dopamine in the brain. There is no cure, and the focus is on quality of life and management of symptoms. If you had a hard time with this question, make sure that you review Parkinson's disease and what causes it. Question number 2. A client is presenting to the doctor's office with new onset of symptoms that have continued to worsen over the past few months. The nurse knows the following symptoms displayed by the patient are the cardinal signs of Parkinson's disease. Select all that apply. Is the answer number 1, bradykinesia, number 2, unilateral resting tremor, number 3, unilateral intentional tremor, or number 4, rigidity? This is another select all that apply, and we will use the true-false method. Number 1 is true, number 2 is true, number 3 is false, and number 4 is true. The thought should have been that Parkinson's disease presents with the cardinal signs of resting tremor, bradykinesia, and rigidity. If you had a hard time remembering the presentation of Parkinson's, make sure to review that. Question number 3. A nurse is caring for a client with Parkinson's disease. The nurse creates a plan of care for the most important nursing diagnosis in a Parkinson's patient, which is it number 1, nutrition less than body requirements, number 2, risk for self-care deficit, number 3, risk for falls, or number 4, risk for electrolyte imbalance? The answer is number 3, risk for falls. In considering disease states, the most important diagnosis is always the physical one first. Safety will be second. In this case, I really want to pick dysphagia or swallowing difficulty, but I don't have that choice in my options. Therefore, I'm going to go with my second best choice, which is safety and risk for falls. When you're studying your diseases, it's important to make sure that you can prioritize your diagnoses. The physical issues should always be first. Question number 4. A client hospitalized with Parkinson's is suffering from dysphagia. What is the most important action when caring for this client? Is it number 1, to sit the client up in high Fowlers while eating? Number 2, assess the swallow? Number 3, ensure the client receives only liquids to decrease aspiration risk? Or number 4, monitor for aspiration post-meals? The answer is number 1. We already know this client has dysphagia, so at this point we're ready to intervene for them. And the most important action is to make sure they don't aspirate. We do that by making sure they sit upright and make sure they have thickened liquids as ordered. Therefore, number 1 is correct. Number 3, be careful, it says to give them liquids. It's easy to aspirate on liquids. We need to make sure the liquids are thickened. Make sure that you always know your interventions for the diseases you're studying. Number 5. A client has been on levodopa for Parkinson's for 7 years. He is now presenting to the clinic with uncontrolled movements and tongue thrusting. He is upset and confused by what is happening to him. He states, "I thought the medicine was working. Why am I having problems controlling my movements?" Which comment by the nurse is appropriate? Is it number 1? "I hear and understand your concern. This is common when you have been on the medication for too long. There is nothing you can do but try to let the symptoms resolve on their own." Number 2, "I am sure you are concerned about what is happening to you. Did you forget to take your medication today? That is probably why you are moving this way. As soon as you take your medication, you will feel better." Number 3, "You are concerned with the uncontrolled movements you are having. Levodopa can cause these movements. It is a side effect of the medication called tardive dyskinesia. I will help you discuss your concerns and possible solutions with your doctor." Number 4, "Unfortunately, this means the medication is no longer working. I will let your doctor know." The answer to this question is number 3. You are concerned with the uncontrolled movements you are having. Levodopa can cause these movements. It is a side effect of the medication called tardive dyskinesia. I will help you discuss your concerns and possible solutions with your doctor. This is a therapeutic communication question. We need to make sure that we, number 1, acknowledge our patient, and then decide whether to assess further or intervene. In this case, we understand what the patient is upset about and will choose to intervene by educating them. If you had a hard time with this question, make sure to review levodopa and know the main side effects. Thank you for joining me in this quick review on Parkinson's disease, critical thinking and learning through questions. If you like this content, follow our channel for more and find us at sciencestrategies.com.